Which of the following is widely considered to mark the beginning of the modern EMS system? A. A paper titled Accidental Death and Disability, the Neglected Disease of Modern Society. B. The current national EMS education standards. C. The creation of the American Heart Association. D. A paper called the EMS Agenda for the Future. Answer A. A paper titled Accidental Death and Disability, the Neglected Disease of Modern Society. EMS care today is based on A. What has been done in the past. B. Whatever physicians recommend. C. Evidence-based medicine. D. The original national standard curriculum. Answer C. Evidence-based medicine. Which of the following describes the EMT level of training? A. Provides basic, immediate care including bleeding control, CPR, AED, and emergency childbirth. B. Includes oxygen and ventilation skills, pulse oximetry, and administration of certain medications. C. Includes advanced assessment and management skills, various invasive skills, and extensive pharmacology interventions. D. Includes advanced airway devices, intravenous and intraosseous access, and blood glucose monitoring. Answer B. Includes oxygen and ventilation skills, pulse oximetry, and administration of certain medications. EMT roles and responsibilities include A. Strong written and verbal communication skills. B. The ability to establish intraosseous access. C. Initial investigation at a crime scene. D. Swift water rescue operations. Answer A. Strong written and verbal communication skills. Which of the following EMT activities is considered high risk for the patient? A. Assessment of vital signs. B. Obtaining a blood glucose test. C. Requesting permission to treat. D. Transferring patient care. Answer D. Transferring patient care. You are called to a business for a patient with dizziness, headache, and nausea. As you enter the business, you detect a strong odor and your eyes begin to water. You should immediately A. Leave the area and call for additional resources. B. Attempt to locate the caller and remove him. C. Apply a mask and safety goggles before continuing. D. Determine the cause of the odor and notify your dispatcher. Answer A. Leave the area and call for additional resources. Which of the following statements regarding stress is correct? A. EMTs can avoid stress by eating healthy and exercising. B. Stress will eventually cause most EMTs to leave the profession. C. Stress is an inevitable consequence of the profession. D. Acute stress develops slowly due to repeat exposure to certain events. Answer C. Stress is an inevitable consequence of the profession. Which of the following is a formalized process to help emergency workers deal with stress? A. Modified duty assignment. B. Critical incident stress management. C. Paid time off. D. EMS stress management exercises. Answer B. Critical incident stress management. Which of the following provides the best protection from exposure to an airborne disease? A. HEPA mask. B. Simple mask. C. Long sleeve gown. D. Mask with splash guard. Answer A. HEPA mask. Which of the following moves is used when the scene is dangerous and the patient must be moved before providing care? A. Urgent move. B. Emergency move. C. Non-urgent move. D. Critical move. Answer B. Emergency move. Which of the following terms refers to the actions an EMS provider is legally allowed to perform based on his or her license or certification level? A. Duty to act. B. Standard of care. C. Scope of practice. D. Doctrine of certification. Answer C. Scope of practice. Which of the following terms refers to the degree of care a reasonable person with similar training should provide in a similar situation? A. Standard of care. B. Scope of practice. C. Standardized curriculum. D. EMS expectation clause. Answer A. Standard of care. Which of the following are specific to resuscitation efforts and do not affect treatment prior to the patient entering cardiac arrest? A. Living will. B. Advance directive. C. DNR order. D. Medical power of attorney. Answer C. DNR order. During a negligence lawsuit, it is shown that the injury to the plaintiff was, at least in part, directly due to the EMT's action or inaction. Which component of negligence is the EMT guilty of? A. Proximate cause. B. Duty to act. C. Breach of duty. D. Gross incompetence. Answer A. Proximate cause. Which of the following is a definitive sign of death? A. Pulselessness. B. Decapitation. C. Apnea. D. Unresponsiveness. Answer B. Decapitation. What federal agency regulates all radio operations in the United States? A. Federal Trade Commission. B. Department of Transportation. C. National Registry of EMTs. D. Federal Communications Commission. Answer D. Federal Communications Commission. Which of the following statements regarding EMS radio communications is correct? A. Begin and end radio transmissions with please and thank you. B. Use the 10 codes approved by the NREMT. C. Use clear text, not radio codes, for EMS communications. D. State over and out at the end of each radio transmission. Answer C. Use clear text, not radio codes, for EMS communications. Which of the following is an example of an objective observation? A. The patient has slurred speech and an unsteady gait. B. The patient is high on something. C. The patient is obviously intoxicated. D. The patient is under the influence of alcohol or drugs. Answer A. The patient has slurred speech and an unsteady gait. Your medical direction has just ordered administration of a medication for your patient. You should immediately A. Administer the medication as directed. B. Check with one additional physician to confirm the order is correct. C. Repeat the order back to ensure you have understood it correctly. D. Ask the physician to verbally acknowledge that you are allowed to give the medication. Answer C. Repeat the order back to ensure you have understood it correctly. Which of the following statements regarding the transfer of care report is correct? A. Transfer of care must always be to the accepting physician. B. Transfer of care must include a verbal report to an equal or higher medical authority. C. Transfer of care is not allowed until you complete your documentation form. D. Transfer of care can be made to anyone as long as the patient agrees. Answer B. Transfer of care must include a verbal report to an equal or higher medical authority. Which of the following regarding homeostasis is correct? A. Homeostasis is a state of balance or equilibrium within the body. B. Homeostasis is assured if all vital signs are within normal limits. C. The body works to avoid homeostasis over prolonged periods. D. Patients who are alert and without pain are demonstrating homeostasis. Answer A. Homeostasis is a state of balance or equilibrium within the body. The frontal plane divides the body into A. Left and right sides. B. Top and bottom halves. C. Anterior and posterior. D. Proximal and distal. Answer C. Anterior and posterior. From anatomical position, which of the following is the lateral bone in the forearm? A. The ulna. B. The radius. C. The humerus. D. The tibia. Answer B. The radius. Ventral refers to the A. Anterior surface. B. Posterior surface. C. Medial aspect. D. Lateral aspect. Answer A. Anterior surface. Your adult patient is unconscious, breathing adequately, and has a pulse. There is no indication of trauma. The patient should be positioned: A. In the shock position. B. Supine. C. Prone. D. Recovery position. Answer D. Recovery position. While assessing an infant, you note depressed fontanelles. This indicates that the infant: A. Is most likely dehydrated. B. Is perfusing normally. C. Has increased intracranial pressure. D. Has been crying recently. Answer A. Is most likely dehydrated. Your patient is 2 years old. She would be considered A. Neonate. B. Infant. C. Toddler. D. Preschooler. Answer C. Toddler. To ease a child's anxiety, it is usually best to: A. Transport rapidly. B. Isolate the child. C. Avoid eye contact. D. Keep caregivers close by. Answer D. Keep caregivers close by. Eating disorders are more common among which of the following age groups? A. Adolescents. B. School age. C. Toddlers. D. Older adults. Answer A. Adolescents. Which of the following statements is correct? A. Mild physical decline typically develops in the young adult age group. B. Women typically experience menopause during early adulthood. C. Physical and mental acuity peaks in late adulthood. D. Accidental trauma is a leading cause of death in the young adult age group. Answer D. Accidental trauma is a leading cause of death in the young adult age group. Which of the following is the backup system to the CO2 drive? A. Carbon dioxide drive. B. Hypoxic drive. C. Anoxic drive. D. Oxygen drive. Answer B. Hypoxic drive. You have just initiated BVM ventilations for your apneic patient. Which of the following is most important to help determine if artificial ventilations are being delivered effectively? A. Check the pupillary response. B. Assess distal pulses. C. Auscultate lung sounds. D. Palpate the chest. Answer C. Auscultate lung sounds. Which of the following indicates the need for supplemental oxygen by nasal cannula or non-rebreather? A. NSAO2 reading of 93%. B. Clear bilateral lung sounds. C. Slow and shallow respirations. D. Warm, dry skin. Answer A. NSAO2 reading of 93%. Your patient is responsive only to painful stimuli. The airway is clear. How should you manage the patient's airway? A. Suction the airway. B. Insert an OPA. C. Insert an NPA. D. Begin artificial ventilations. Answer C. Insert an NPA. Due to the risk of hypoxia, suction time should not exceed: A. 30 seconds for an adult. B. 30 seconds for a child. C. 15 seconds for an infant. D. 15 seconds for an adult. Answer D. 15 seconds for an adult. While obtaining a patient history, you note the patient takes several prescription medications daily. This is known as A. Multimes. B. Polypharmacy. C. Unipharmacy. D. Copharmacy. Answer B. Polypharmacy. Symptoms that are important to consider, but denied by the patient are known as A. Pertinent negatives. B. Chief complaints. C. Dissociated symptoms. D. Irrelevant assessments. Answer A. Pertinent negatives. During your assessment, you note the patient has irregular breathing. This means the patient A. has an increased work of breathing. B. requires immediate ventilatory support. C. has minimal chest rise with each breath. D. presents with an abnormal breathing pattern. Answer: D. presents with an abnormal breathing pattern. Your 5-year-old patient is unresponsive. To determine if chest compressions are indicated, you should immediately assess the A. radial pulse, B. brachial pulse, C. carotid pulse, D. pedal pulse. Answer: C. carotid pulse. Your trauma patient has a widening pulse pressure. You should suspect A. a head injury, B. hypoperfusion, C. tension pneumothorax, D. pericardial tamponade. Answer: A. a head injury. Which of the following medications is administered enterally? A. EpiPen, B. nitroglycerin, C. oral glucose, D. naloxone. Answer: C. oral glucose. Which of the following medications is used to reverse the effects of an opioid overdose? A. Narcan, B. epinephrine, C. glucagon, D. albuterol. Answer: A. Narcan. Which of the following is a common side effect of nitroglycerin administration? A. reduced heart rate, B. elevated blood pressure, C. decreased chest pain, D. reduced blood pressure. Answer: D. reduced blood pressure. EMTs can help administer, but cannot carry, which of the following medications? A. MDI, B. oral glucose, C. oxygen, D. aspirin. Answer: A. MDI. Which of the following medications is an adsorbent? A. oral glucose, B. activated charcoal, C. epinephrine, D. naloxone. Answer: B. activated charcoal. You have completed the primary assessment on an unresponsive multisystem trauma patient. Which of the following should be done next? A. obtain a patient history, B. manage any secondary injuries, C. assess baseline vital signs, D. document your findings and interventions. Answer: C. assess baseline vital signs. Which of the following statements regarding the primary assessment is correct? A. the primary assessment always precedes the patient history. B. the primary assessment is not necessary for conscious non-trauma patients. C. the primary assessment may follow the patient history for medical patients. D. the primary assessment should never take longer than 90 seconds. Answer: A. the primary assessment always precedes the patient history. You have completed the primary assessment on a conscious patient complaining of dyspnea. There is no trauma. Which of the following should be done next? A. manage any secondary injuries, B. obtain a patient history, C. perform a detailed physical exam, D. check the posterior for any injuries. Answer: B. obtain a patient history. Which of the following is always your first priority while performing a physical exam on a patient? A. identify and manage life-threatening conditions, B. initiate transport within 10 minutes, C. you and your partner's safety, D. requesting additional resources as needed. Answer: C. you and your partner's safety. What is the purpose of the rapid scan? A. assess and manage the ABCs, B. identify all secondary injuries, C. reassess all injuries and interventions, D. identify any remaining life threats. Answer: D. identify any remaining life threats. Shock or hypoperfusion describes a state of A. hypotension, B. Hypoxia. C. Inadequate tissue perfusion. D. Irreversible system collapse. Answer: C. Inadequate tissue perfusion. Your trauma patient has lost an unknown amount of blood. The patient is alert, his pulse rate is slightly elevated, and his BP is normal. Based on this information, the patient is most likely experiencing A. Compensated shock. B. Anaphylactic shock. C. Decompensated shock. D. Neurogenic shock. Answer: A. Compensated shock. You are assessing your patient for signs and symptoms of shock. You note tachycardia and pale, cool skin. These findings are: A. Signs of impending circulatory collapse. B. Indications the patient is not in shock. C. Examples of the body's defense mechanisms. D. Not likely related to the patient's state of shock. Answer: C. Examples of the body's defense mechanisms. Your patient presents with signs and symptoms of hypoperfusion. You note the patient's blood pressure is lower each time you reassess vitals. This indicates the patient A. Is adequately compensating. B. Is in irreversible shock. C. Has undiscovered injuries. D. Is in decompensated shock. Answer: D. Is in decompensated shock. Which of the following statements regarding shock in pediatric patients is correct? A. Pediatric patients rarely develop shock. B. Pediatric patients can be in serious danger and still present without hypotension. C. Pediatric patients tend to become hypotensive even during compensated shock. D. Signs of shock with hypotension are not usually serious in pediatric patients. Answer: B. Pediatric patients can be in serious danger and still present without hypotension.